I'm Nurse Autumn, and I'm going to be doing your assessment today. So, can you tell me what your name and your date of birth is?
Barbara Holbrook, January 29th, 1973.
All right, can you tell me where you are?
I'm at a hospital
Do you know why you're here?
for a complete head-to-toe assessment.
Can you tell me today's date?
April 23rd, 2020,
And can you tell me who the President of the United States is?
Donald Trump.
All right. So, first we are going to start with your vital signs. So, if you could get off the bed real quick and come over here to the scale, we'll get your weight. All right, 139 pounds. You can go ahead and go back and sit down. Don't have to lay down though. You can go ahead and keep your knees off the bed here. And go ahead and scooch down right here. All right. So now I'm going to get your radial pulse. I'm going to keep it across here. You have 14 respirations and your radial pulse is 64 beats per minute. Alright, so now we're going to go ahead and do your blood pressure. So go ahead and give me this arm. Alright, 124 over 74. Alright, so can you tell me what your pain is on a scale of 1 to 10?
0.
Alright, sounds great. Alright, so normally I would also get her temperature as well as her pulse ox, but since I don't have a thermometer or pulse oximetry meter, I can't do those things. I also get her height and her waist circumference as well as her body mass index. And I'd also use a Snellen eye chart to see her vision, but I don't have that as well either, so I can't use those. Alright, so go ahead and give me your hands. Alright, so first I'm going to check for temperature bilaterally. Alright, we're all good. I'm going to check for capillary refills. Yes, ma'am. Alright, I'm going to check for trigger. Good. I might also check up here as well. If you can hunch over a little bit. Alright, that's good. So I'd also check for the color and pigmentation, which seems to be good for her background of ethnicity. The moisture is good as well, and so is the texture of the skin. There don't seem to be any lesions on either arm or on either hands, so we're all good there. So now I would check her head and her scalp to see if there's any lesions or any bumps. Is any of this painful?
No, feels good.
Alright, so her head is symmetric normocephalic. So now I'm going to have you look at me. Can you wrinkle your forehead for me? Squint your eyes. Clench your teeth. puff up your cheeks. All right, thank you. So now I'm gonna look for your temporal artery. All right. Now can you open and close your mouth for me? All right. Now, can you do that again? All right, and one more time. All right. So now I'm gonna palpate her maxillary sinuses. I'm also gonna palpate her frontal sinuses as well. Alright, so now we'll move on to eyes. Like I said, we can't use the Snellen eye chart because I don't have it. So we're going to go with the confrontation test. So you're going to hold it up to this eye, same as me. You're going to tell me when you can see my finger.
No.
Alright, other eye.
No.
Alright. Alright, so now I'm going to take my pen light. And it's on. So first I'm going to look to make sure everything's symmetrical, nothing's off. Then I'm going to have you look past my shoulder. And I'm going to use a pen light. Alright, look past my other shoulder. Alright, now I'm going to have you look past my shoulder again, focus on something behind me. And now I'm going to have you focus on my finger in front of me. Alright. So now I am going to have you follow my pen light. Don't move your head, just move your eyes. Okay. Good. So now I would usually have the ophthalmoscope and I would check her discs, her vessels, and retinal background, as well as her red reflex in her eye, but I can't do that, so I'm going to go ahead and check with my pen light to see if the light reflects off her cornea symmetrically, and I'm also going to palpate a couple things on her face as well. So just look at me. Alright, light reflex is good. I'm going to poke the puncta to see if they are okay. Right, now I'm going to have you look up. Look down on the lids. Now look down for me. I'm going to look in the upper lids. You're going to do the same thing for me. Look up for me. Now look down. Alright, look up. Look down. Alright. So now I would usually use the otoscope in the ears to check the tympanic membrane for the pearly gray tympanic membrane there, but I don't have the otoscope with me, so I can't check her ears, nose, or mouth with it, but I can use my pen light for her nose and her mouth. So I'm going to go ahead and palpate your ears first. So if there's any pain, tell me. Any pain?
No.
Alright. So now I'm going to, so if I were using the ophthalmoscope, I would also, or the otoscope, my bad, I would pull the pen up and back in her. I would also hold the otoscope upside down, not right way like you would with the nose. So I would also use a tuning fork on the top of her head, as well as each side by her ears, and as holding it just near the ear to see if she could hear it. For now, I'm going to have you plug one ear, and I'm going to move over this way, and I'm going to whisper 3 either letters or numbers, and you're going to repeat them back to me, okay?
Mm-hmm.
1B2.
1B2.
All right, now go ahead and plug this ear. I'm going to move over this way. We're going to do the same thing. 6C7.
6C7.
All right. So now I'd look at her nose. I'd look to make sure nothing's abnormal, everything's symmetric, everything's good. So now plug one side of your nose. Inhale and exhale. Do the same other side. All right, that's good. All right, so now for her mouth, I would look at her lips as well as her buccal mucosa to make sure everything's good. Everything's good. Go ahead and open your mouth. Look in, look at the tonsils. They're there, they're great too, they're good. So what I normally do is I'd have gloves and I would use my hand hygiene. I would have a pad and I would take her tongue and I would move it side to side to check. So go ahead and move your tongue side to side. Other side. All right, good. Now go ahead and poke your tongue back out and wiggle it side to side. Good. I'd also have a tongue depressor to press on her tongue. Now go ahead and say ah.
Ah.
All right, that's good. I would also palpate in her mouth, but as I said, I don't have gloves, so then I would do my hand hygiene. All right. So now I'm going to go ahead and check her neck, see if anything is asymmetrical, make sure everything's symmetrical. So nothing seems out of place. I'm going to check her lymph nodes, all 10 of them. If anything hurts, please tell me. All right, go ahead and hunch your shoulders for me. All right, good. Nothing hurt?
Nope.
All right, I'm gonna go ahead and use my stethoscope. I'm gonna use the bell to listen to your carotid artery, listen for bruits. And we're good. So there's no swollen, so everything's good, there's no bruit. So I'm gonna palpate your trachea. So I'm gonna push it to the side, feel, push it to the side, and feel. All right, now I'm gonna have you come to the edge of the bed so I can get behind you. And have you take this cup of water. I'm gonna have you tilt your head back, and I'm gonna have you sip the water. All right, good. Now tilt your head forward and just a little slightly into the right. All right, now tilt your head forward slightly into the left, please. All right, now it's palpating for the thyroid gland. Nothing's enlarged, so it means no bruits necessarily. I'm also going to have you push against my hand. All right, push against my other hand. Also have to push against my hands. Raise shoulders. Good. All right. So now we're gonna do the chest, lungs, and posterior lateral. So if you could, I'm gonna have you raise up your tank top just to the underneath of your bra. And put this right in front of you. So I check to make sure the skin is good. There's no obvious lesions, no swellings. Everything's asymmetrical. I'm gonna do symmetric chest expansion, so if you could breathe in for me. Breathe out. Good. All right, so now I'm going to check for tactile firmitis. So if you could for me, please, say 99.
99.
Again.
99.
Okay.
99. 99. 99. 99. 99. 99.
Good. All right. So then I haven't felt any lumps or tenderness. Her spinous process seems straight. I'm gonna go ahead and listen to everything. You always listen before you percuss. So now I'm going to go ahead and percuss for timpani. So now I'm also going to check for costovertebral angle tenderness. Please tell me if this hurts. All good?
Yep.
All right. So listening to the breath sounds, nothing sounded off, nothing sounded adventitious, it all sounded very good. So now I'm going to have you do some ROM at the range of motion of the upper extremities. So you can bring your hands out to me. All right, go and push against my hands. All right, again. Okay, so bring your arms like this, and bring them out, bring them up, bring them behind your head. All right, that's good. That feels nice. Now I'm gonna have you shake my hand. I'm gonna palpate for nodes here, that petrocular node. All right, we're all good. So now I have to go ahead and go back up to the head of the bed. And they're gonna lie at a 30 to 45 degree angle. Might not be very good as we don't have a hospital bed. All right, so here, go ahead and have your head right there, not too back. All right, looking for circular pulsations. All right, now you can go ahead and fully lay down. So from what I can see, everything's all right. I will note that her ribs are a little offset from a previous pregnancy that's in her health history. This side is up further than the other side. So I'm going to start with tactile firmitis, so please say 99.
99, 99, 99, 99, 99, 99.
All right. So now I'm going to go ahead and listen. I'm going to use the bell to listen for any possible bruits. All right. So I'm going to go ahead and percuss for timpani in the upper range. So now I'm going to go ahead and feel for her apical pulse, which is not usually palpable in most people. All right. I'm going to go ahead and listen to the apical pulse for a minute. So I'm just gonna go ahead and feel up here. Make sure there are no frills in the precordium. Alright. So now I'm gonna move on to the abdomen. So we have her shoulder pulled up just a little bit. So, like I said before, her ribs are just slightly higher on one side than the other. So, looks like her umbilicus is midline. And her abdomen is flat. So first, I'm going to go ahead and I'm going to listen to her bowel sounds. Alright, there are bowel sounds present in all 4 quadrants, so now I'm going to look for vascular sounds. So now I'm going to go ahead and percuss the abdomen. Alright, so now I'm going to palpate down the midclavicular line on her right side to try and find the liver. Back up this way. Okay, so now I'm going to go ahead on this side. It's going to be a little lower. So, okay. Alright. So now I'm going to go ahead and do light and deep palpation. So I'm first going to start with light, and if anything hurts, just go ahead and tell me. Just trying to make sure any organs, if they're inflamed, maybe if they're enlarged. Nothing hurt?
Nope.
Alright, I'm going to go on to deep palpitation. Let me know if anything hurts. Nothing hurt? Nothing good?
Nothing.
Alright, so now we're going to go ahead and try and palpate for the liver. So I want you to go ahead and breathe in for me. Alright. The liver usually isn't palpable in most people. So now we're going to go ahead and palpate your spine. Or not your spine, your spleen. My bad. So go ahead and breathe in. Alright. Thank you. So I'm also going to feel for the kidneys now as well. So breathe in. Okay, breathe out. And do the same thing on the side as well. Go ahead and breathe in. And out. I'm also going to palpate for the aorta down here. So breathe in. And out. Alright. So now we're going to move on to your lower extremities. So I'm going to feel temperature first. Alright, temperature seems to be bilateral. So the skin characteristics seems to be no lesions, no, the symmetry is fine, so nothing's asymmetrical. Go ahead and have you do a butterfly position. Bring your feet up, yep, and feel for the popliteal pulse. Alright, so I'm going to feel for the pulse down here, your posterior tibial. Now you can go ahead and straighten your legs back out and feel for the dorsalis pedis. I'm going to check for any pretibial edema. Alright. I'm also going to check for capillary refill on the toes. Seems all good. Alright, so now I'm going to have you sit back up again. And you can go ahead and swing your legs off to the side. So you're going to check your knees out here. Have you lift your legs. Alright, go ahead and sit them back down. Go ahead and move your ankles around for me. Very good. Alright, so now I want you to lay back down again. We're going to do some ROM in your legs, just like we just did in your feet. Okay. So have you lift both your legs up. Yep, now put them back down. Now lift them one at a time. Good. Lift the other one. Alright. Now lift it just slightly and press on my, yep. Now press on my hand. Yep. Bring this one up. Again. Thank you. So now if you bring your leg up to your chest and then out to the side. Yep. And do that with the other leg, please. Alright. Now if you can just swing this leg just right out here for me. Alright. Now do that to the other side, going that way. Thank you. Alright, so now you go ahead and sit back up and swing your feet back over. So now we're going to focus on neurologic. So I'm going to take this cotton ball and go ahead and close your eyes. And whenever you feel it touch your face, let me know.
No. 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 No.
Alright. A little ticklish, isn't it?
Yes.
Alright, so now I'm going to do the same thing. And I'm also going to have this little tack so we can differentiate between sharp and dull.
No.
Please say sharp
Oh,
or dull.
sorry.
You're alright.
Dull. Sharp. Sharp. Dull.
Alright, now place your hands out on your knees, please.
Dull. Sharp. Sharp. Dull.
Alright, now I'm going to do the same thing down here on your legs.
Dull. Sharp. Sharp. Sharp.
Alright. So now I'm going to have you close your eyes and give me your hand. Now I'm going to have you tell me if I'm moving your finger up or down or side to side.
Up. Down.
Okay, give me your other hand.
Side to side.
Alright, I'm going to do the same thing with your toe.
Up, down. Side to side.
Alright. So now I'm going to give you, go ahead and close your eyes. I'm going to give you two objects, one in each hand. I want you to tell me what hand has what.
Pencil or pen.
Mm-hmm.
Paper clip.
Yep. Alright. So now I'm going to have my finger here, and you're going to touch your finger to my finger and back to your nose. And just keep doing it. Alright, good. Alright, so now go ahead and lay back down. And I want you to take your right shin, put it on your left, or your right heel, put it on your left shin and drag it. Yep. Now go ahead and repeat with the other side. Very good. Alright, so now we would do deep tendon reflexes, so you can go ahead and sit up. I don't have a hammer, and I don't want to damage my stethoscope, so I would tell you what I would have done. So for the biceps, I would have had the sharp edge, and I would have used both arms and hit for the bicep. On your arm, just right here. And I would use the sharp edge. I would also take her arm out here for the triceps, and I'd hit with the sharp edge, and I'd do that on both arms. I would then take her thumb in my hand, and I would use the sharp edge down here on her hand as well. Then I would take the dull edge, and I would hit it on both of her knees. Then I would also take the dull edge and hit it on the back of her ankle for her Achilles reflex as well. So you can go ahead and lay back down for me one more time. Now I do the Babinski reflex. So I would take my pencil and I would lift her leg up. Alright. Very good. Alright. So now go ahead and stand all the way up. We're almost there. We're on the musculoskeletal now. So what I'm having you do is just right here, I want you to pace across the room. Alright, now walk heel toe, please. Very good. Now walk back on your toes. And now walk back to me on your heels. Very good. Now I'm going to have you stand here, and you're going to close your eyes, and you're going to try and stay in place for about 15 seconds, all right? All right, very good. So now I want you to turn around that way. I want you to go ahead and touch your toes. So I check your spinous process. Spine is straight, so that means no scoliosis. So now I'm going to have you stand back up for me. And I'm going to hold you right here, and I want you to tip to one side, and then tip to the other. I want you to rotate to one side, and rotate to the other. And I want you to touch your toes again. All right. Go ahead and sit down again. And is there any questions? Anything else?
No.
All right. Thank you very much.
Thank you.